Good morning, good afternoon, depending on wherever you are. Thank you for choosing to spend your time with us today. My name is Amy Herrera. I'm a special agent at the FBI's Washington, D.C. field office, and I'm here to provide just a few minutes of quick administrative matters before we jump into the meat of today's webinar. So first off, yes, we are recording today. Yes, you will be able to find this very recording on a publicly accessible website probably by tomorrow afternoon, depending on how quickly I can format the video. So you will get confirmation email tomorrow that confirms your attendance here today, and that email will contain the link where you can find the recording from today in case you'd like to go back and watch it again or share it with family or friends who might benefit. There is one handout that we have loaded into the webinar platform for you today. It's an intelligence product about genetic testing pertaining to fraud matters in healthcare. You're welcome to take that, download it, print it, share it, email it around to anyone who might want to read it. The more broadly we can spread this messaging, we think the better. So the handout is yours to do with as you wish. We are not issuing continuing education credits for today's webinar. If you are attending looking for CEUs for your job, then you're welcome to submit the certificate that you'll receive tomorrow to whatever organization typically issues your CEUs, and they can grant those CEU credits to you. They will not come from us. If you have questions, we welcome your questions. We have designed today to address the questions that many of you submitted when you registered for this webinar today. If there are other questions that come to your mind, please enter them in the question box anytime, and we will get to as many of those questions as we can while we're here together for the next hour. If you're a member of the media and you're looking to write a story about what you hear today, fantastic. Please let us know. Reach out directly through the chat box or the question box, and we'll connect you with our public affairs folks who can facilitate that process for you. More broadly, it's good for you to know that this is the first of a series of 4 webinars in June, all under the Elder Justice umbrella. So we're really focusing on matters that affect older adults, particularly matters that are linked to healthcare, because of the focus on healthcare events in the month of June. So the FBI's Washington field office has a ton of partner agencies that are helping put these on throughout the whole month of June. Today, you're going to hear from an FBI expert and also from an expert at AARP, which is one of our co-sponsors for this series. The National Capital Region chapter of InfraGard are the ones that provide the software that we use for these webinars. So thank you to InfraGard NCR for allowing us the use of this platform so we can speak to all of you today. I think that's the end of my administrative announcements. I'm checking my checklist, and yes, we hit them all. Woo! So time to jump into the good stuff. I am very pleased to be able to introduce my friend Greg Heeb. He's the unit chief for the healthcare fraud unit at FBI headquarters, and he is up first today to share some thoughts with you about healthcare fraud. Greg, I turn the virtual microphone over to you.
Thanks a lot, Amy. I'm honored to be here. I appreciate the invitation. I think I get some important information to share with you that will help the audience. I also want to say thanks to InfraGard chapter there. I appreciate the opportunity. It's something that we definitely value, and our partners at AARP we're working with to try to get the word out, because it's so important, and I'll kind of explain why it's so important to get the word out when it comes to healthcare fraud. So we'll kind of go through. I'm going to give you a little bit of an overview of the FBI's healthcare fraud program. We're going to talk a little bit about the healthcare fraud threat, as we call it. I'm going to talk about how it impacts you, because unlike a lot of other crimes that the FBI investigates, healthcare fraud, it's definitely not a victimless crime, but it's not as direct in terms of impact on potential victims as other crimes might be. And I'll explain what I mean by that as we move through the presentation. And then at the end, I am going to share with you, and I'm sure Amy from AARP will as well, some tips on how you can protect yourself from becoming a victim of healthcare fraud. And the goal for all of us, and I think our collective goal today, and certainly our goal in the FBI, is to protect the healthcare system as we know it in America, so that it's available to maintain the health and well-being of United States citizens. So this is really an important violation, but sometimes complex. So we'll go through it, and as Amy said, if you have questions, please feel free to ask them at the end. I'm going to try to hit on some of the questions we got previously in the presentation, but I'm happy to explain anything else that anyone may have a question about. So we'll get started. So the threat itself, it's very broad. Healthcare fraud exists in nearly every segment of the healthcare industry, and it affects almost all sectors of our economy. The schemes, just like everything else, they're continually evolving. They're very difficult to track in many cases. They're complex because in some cases we're trying to determine whether or not we're dealing with a true medical professional's opinion or if we're dealing with something that really is truly fraud. So there's a lot of discretion and there's a lot of investigative work that goes into these cases to be able to prove what we need to prove if we do believe that fraud is occurring. So telemedicine, particularly, I think I would venture to guess that many of you on the line, myself included, have had an experience with telemedicine. It was in existence well before the COVID-19 pandemic hit, but because of regulatory changes and the desire by the government to ensure that everyone had easy access to healthcare, the rules to allow people to get appointments and access healthcare through telemedicine were expanded significantly. And it looks like, from everything we've seen, that they're here to stay. So we're going to be, working to address that, because as I'll get into as well, there's a number of challenges that came about as a result of telemedicine and just, threats now and providers that are all over the country that could be part of a fraud scheme that we're looking into. So like I say, I'll get into that a little bit more as well. In addition to healthcare fraud, the FBI and our agents across the country were investigating non-insurance related fraud. Could be anything from, embezzlement occurring at a provider's office or a medical provider's office, a hospital. It's really kind of broad in terms of if there's some nexus to a medical provider, it could fall under our healthcare fraud program in the FBI. Privacy violations, each and every time you go to a provider, whether it's telemedicine or you physically go into the office, you're providing protected health information to that provider. They have an obligation under the law as a covered entity to protect that information. If the information is somehow compromised or released, whether it's intentional or accidental, the FBI is made aware of that through a mutual agreement we have with the Department of Health and Human Services, and we'll look at those incidents to determine whether or not there's any criminal culpability involved. So that's another function that we carry out here in the unit to review those referrals to determine whether there's criminal conduct. And threats to the public health. I don't think it's a surprise to anybody on the call that the opioid epidemic has hit this country hard. We used to see traditional pill mills where doctors, without any medical necessity, were taking cash payments in order to provide highly addictive opioids. So we have a program within our healthcare fraud unit and throughout the field offices to look into illegal prescription drug diversion. I'll talk a little bit more about that as well. So the losses in healthcare fraud are staggering. Before working healthcare fraud, I worked complex financial crimes, embezzlement cases, market manipulation schemes, things of that nature. The losses there were significant, but they pale in comparison to the losses that we see in healthcare fraud cases. And the reason for that is, if you stop and think about it, our healthcare fraud system in America is designed to provide access to care quickly, to make sure that the providers are paid quickly, so there's no disincentive for people to get treatment quickly. And as a result, when fraud occurs, if a provider is committing healthcare fraud, we may not be aware of that fraud right away. It might be months or even years before the data, mostly claims data or billing data, reveals some sort of abnormal behavior or abnormality that suggests that one provider in a certain area of the country is billing far more for a particular service than any other provider in the country. And that would cause most law enforcement entities that are responsible to investigate these things to look at that provider and say, what is going on here? Is there a reason that this provider could be billing so much more for this particular service than any other provider in the country? If it turns out that it's fraudulent, then we are looking back through all of the data, conducting a number of interviews of patients that were involved, asking, for instance, did you get this service that your provider billed for? And if not, we've probably got a pretty clear-cut case of fraud. But by the point it's identified, there could be, as I said, years of this behavior taking place. So hundreds, millions of dollars gone. And what I alluded to earlier in the presentation is that healthcare fraud is not a victimless crime by any stretch. But what often happens is somebody goes to a provider, the provider, for example, overbills for a service. You go in for a simple medical physical, that doctor bills your insurance company or Medicare for a very, very complex procedure and gets much more money than they otherwise should have received for the treatment that you were given. In many cases, that doesn't directly impact you. Medicare may pay the bill, your private insurance company may pay the bill. It may not involve anything out of pocket for you, other than maybe, a copay that you paid for the visit in general. The challenge is trying to articulate to the general public that the impact that we have, although indirect for the most part, can really have a negative effect on everything. Health insurance premium goes up. In the case of public programs like Medicare and Medicaid, Medicare is funded through tax dollars. Taxes can go up. In fact, Medicare, when reevaluating the costs, can adjust the amount that you would contribute. Worst case scenario, if a provider does something fraudulent and bills for a service that you're only allowed to get once per year under your plan, and that service was never provided to you and is now unavailable, there's a possibility that you would be denied a medical service that you need as a result of fraud. So at the end of the day, healthcare fraud has an impact in increasing expenses, increasing out-of-pocket costs for all of us, and then a reduction ultimately in the benefits that you'll get, whether it's a private plan or a public health insurance program like Medicare or Medicaid. To give it a little more perspective, 2019 in the United States, we spent about $3.8 trillion on national health expenditures. And this includes everything from hospital construction to medical care. And I'll break down a little bit more what it is, but that's about $11,582 per person. 2020, up even more. I think it was about 9%. 4.1 trillion was spent on healthcare in this country. That's about $12,530 a person. Here's the part, this is sometimes tough to understand, but 3 to 10% of that is the best estimate we have of what's actually lost to fraud, and that comes from the National Healthcare Anti-Fraud Association. 3 to 10% of our total expenditures on healthcare in this country completely lost to fraud. That's anywhere between $115 billion to $386 billion a year gone. So it's hard to comprehend that large of a loss, but it's significant. And this is just to show you that since the Centers for Medicare and Medicaid Services started tracking healthcare fraud, healthcare expenditures in 1960, you can see how much the expenditures have gone up. It's generally in the last 5 or 6 years, other than 2019 to 2020, which isn't on here, about 9%, but it was generally about 4.5% to 5% of an increase every year in expenditures. So pretty significant. Hospital care makes up the brunt of the expenditures in this country, about 31%. And the next biggest would be physicians and clinical services. And these are all available at the Centers for Medicare and Medicaid Services. They tremendous job compiling the data. Tell you a little bit about our program. We are part of the complex financial crimes program in the FBI, so a lot of white collar crime, as I said before, general fraud matters, market manipulation cases. We fall under the financial crime section. Our mission here is to reduce and prevent significant financial crimes and harm against individuals, businesses, and industries involved in the administration of our healthcare system in America. And simply put, we want to protect the system to keep Americans healthy. We have a role in the FBI, not only investigating fraud that's targeting private insurance, so a lot of the insurance that folks get through their employers, but also working with our partners in the Department of Health and Human Services, Office of Inspector General, in investigating fraud that targets those critical public programs like Medicare and Medicaid and some of the military programs like TRICARE. So we have investigative responsibility for all of those programs. Some we work jointly, as I said, with our partners at HHS OIG. Every single field office that the FBI has special agents and professional staff members that are responsible for investigating healthcare fraud in their what we call areas of responsibility or their territory. There's approximately 432 special agents throughout the FBI that are responsible for investigating healthcare fraud that's occurring in the country, about 327 professional staff. At any given point in time, about 2,500 pending healthcare fraud cases. These tend to be long-term investigations for a lot of the reasons I mentioned earlier, that we deal a lot with data. So in addition to the data, we rely really heavily on calls and information received from the general public to help us to determine whether fraud's occurring. Sometimes it's a combination of both, but these cases tend to be complex. And for example, if you go to a provider and you notice something suspicious, and I'll talk about some of the schemes here in the next slides, and you report that to either your insurance company or to the FBI or to our partners at HHS OIG, that would prompt us with some other factors to look into it a little bit closer. But that typically involves a number of interviews of patients to see whether or not, the scope of the fraud, whether or not it was really fraud and not a legitimate medical reason for whatever the issue is, excessive procedures, whatever. But these cases take time. Some can take up to 6 years to resolve. So they're quite complex and time consuming. Just to give you a little bit of an idea of what we've got, 252 arrests to date in FY22. That's October 1st of 21 until that's our fiscal year until September 30th, 2022. As you can see, there was a bit of a dip during the pandemic, FY20 and FY21. So we're making up a lot of that when courts were closed in the current fiscal year. But just to give you some information on our numbers here. FY21, about $5 billion in won or negotiated judgments and settlements. Now, these are settlements that the government's entered into an agreement with the defendant to provide. A big portion of this, I think many of you might be familiar with the Purdue Pharma case, and that is a negotiated settlement that, as far as I know, is still tied up in bankruptcy proceedings, but that ties into that. The $5 billion is won or negotiated. That's not the money that's been collected yet. That's what we hope to collect. 1.9 billion is what's been returned to the federal government in FY21, and about 1.2 billion of that went back into the Medicare trust fund. So that's the goal here. When we identify the fraud, we target the subject, obviously, that was involved, to try to have an effect on others that might be considering engaging in fraud, to send a message, but also to recover some of that money, if not all of it, that was lost, to give back to the programs or private plans that lost it. To do it, we work very, very closely with the private sector. We work closely with the insurance companies, both at the national level and the field office level. So we're constantly communicating with the private providers. I know some of the Medicare Advantage plans are administered by the private providers. We are constantly sharing data with those providers to identify and investigate fraud. So they're a very strong partner for us, in addition to the government agencies, in investigating fraud. And these are some of the government agencies that we work with on a daily basis. We can't do it alone as an agency. It's too big of a threat. And we rely heavily on not only our partners in private insurance and law enforcement and regulatory partners, but also folks like you and the public who take the time to call us and let us know that something isn't right. This is my team here at headquarters, including our intelligence folks. We are responsible for managing the FBI's healthcare fraud program throughout the country, so all the programs in the 56 field offices. We provide program guidance, share intelligence. We establish and maintain relationships at the national level, as I explained, with our partners in the public and private sector. I just want to share with you, this is kind of important, the common scheme. So these are the types of things that we see, that we investigate, that we would ask you as patients in many cases and members of the public to try to look for. And you know, if you spot things like this, to please call us. And don't worry about whether you got all the specific details of each one. You'll get the general gist of it. But what we see a lot, billing for services that simply were not rendered. So you go to a doctor's office, sometimes it's as clear cut as you go to the doctor's office on one day, they bill Medicare for an appointment on the next day that you never went to. That's pretty clear cut. Requires some investigation, but pretty clear that something's not right. Other cases, you go to the doctor's office, you go in for a routine physical, as I mentioned earlier, but the doctor's office bills you for a very complex medical appointment for a much longer time period than you were actually there. It includes a number of add-on services that you may not have obtained. So that's a common scheme we see. But as you can imagine, it gets pretty complicated in trying to determine whether or not those add-on services were necessary or not. And that's where our work comes into play. Sometimes excessive services, we saw that a lot during COVID-19, where you would go in to get a COVID test because people so desperately needed to get the tests at a certain point in time. Some of the laboratories, unscrupulous laboratories, or doctors would order unnecessary tests in addition to your COVID-19 test to benefit financially from those tests. So in other words, you go in for COVID-19 tests, that doctor may normally get $150 reimbursement for that test, but they say, you know what, I'm going to add on a genetic test or a respiratory pathogen panel test. In some cases, the patient never even gets the results of the tests or never even knows those tests were conducted, but their insurance company or Medicare pays for the extra services. That's what we call the excessive services scheme. Very, very common, up into the billions of dollars in losses during the pandemic. Unbundling of services, you go in for, you know, a panel of blood tests. Those are normally billed to your provider or Medicare as a panel. Some providers that are unscrupulous will separate them out and bill them separately as though they occurred on different days in order to maximize their reimbursement. Sometimes you see just plain double billing. Best example we saw recently was x-rays. Patient goes in and gets an x-ray. Their insurance company's billed for that x-ray. The provider is reimbursed. That same exact x-ray is used using a different patient's name for another 30 days and billed every day as though it's a different patient, even though it's just one x-ray from one patient. And it just continues and continues and continues. And unless someone reports that to us, we're relying on the data, the billing data, to come in to tell us that, hey, something's wrong. And then we're going back. Because what we really have here is what we like to call in the Bureau, among the law enforcement components here, is a pay and chase model. The claims are paid. We realize there's fraud. We go back and try to get the money. It's not ideal, but it's a balance. As I said, trying to provide the best possible care that can be provided in the country, while at the same time making sure that you know, we try to eliminate the fraud as best as we can. Kickbacks, illegal when we're talking about government programs, but that would be something to the effect of the doctor is paid by a laboratory in order for the doctor to order unnecessary tests. So the lab says, okay, doc, I'll give you $50 for every blood test that you order that goes to my laboratory. Completely illegal when we're talking about Medicare or Medicaid billing. It's just not acceptable. We see them hidden in all kinds of, it's instead of simple cash payments, in many cases, it might be hidden as speaker fees to the doctor, like, hey, you know, doctor will send you on a vacation or whatever. Anything of value can be considered a kickback if it's paid in exchange for getting a patient to take some service that's paid for by a government program. Spiked billing, not too common, but some providers will take advantage of loopholes in insurance to get paid up front for complex procedures and then may not provide the procedures, and they may close their practice and move on somewhere else after taking the money. Important for everybody on the line, really very, very common, during COVID-19 and throughout the year, frankly. Identity theft. What does that look like in the medical context? You get unsolicited contact from somebody. Somebody offers you a free service. Somebody approaches you as you're leaving the grocery store or the pharmacy, and they say, hey, you know, genetic tests can really identify if you're susceptible to cancer in the future. We think you should go sign up. You should go get this genetic test. In some cases, they tell you, hey, give us your Medicare number. We'll get it all set up for you. That Medicare number is like gold. It's like a limitless credit card for these folks. So just be careful when you're getting an unsolicited contact asking you for your Medicare or health insurance information. If it's not a doctor you know or trust, you need to think twice about providing it, or maybe stop, go back to your doctor, call your primary physician whom you have an existing relationship with, and find out whether this is something that you should do or not do. Billing for medically unnecessary service, kind of as simple as it sounds, and that kind of ties into the COVID testing and the lab tests as well. It would be just adding on a number of very unnecessary services and then billing the provider for it. Some emerging schemes that we're seeing right now in the Bureau: telehealth, telemedicine. Double-edged sword. Great in the sense that it gave a number of people who didn't want to get in a car, didn't want to go to public because of the risk, to see a provider in person. They could get on the phone and meet with a telemedicine or telehealth provider. It was great. The problem that we've seen with it on our end is that sometimes it's used to facilitate fraud. We might have a doctor in Texas who's ordering all kinds of unnecessary tests in New York. And now it takes some more coordination and cooperation among not only our components within the FBI, but our partners in law enforcement at CMS on the regulatory side to track this down. So it's really expanded the scope of our threat and provided sometimes a way to facilitate fraud that we didn't see to the extent that we do now. Sober homes are big. These are treatment facilities where people, again, opioid epidemic, a number of people are seeking treatment to try to get off of these powerful opioids. Some unscrupulous providers are taking advantage of those folks, sometimes injecting them with drugs or giving them drugs or buying insurance plans for them just so that they can defraud those plans with no real intention of ever helping these people get sober. It's simply a money-making venture in many cases. We talked about the laboratory fraud. These are the add-ons. And compounding pharmacy frauds, huge. You may see that as well, where all of a sudden in the mail you receive a compounded medication or a very expensive medication from a compounding pharmacy that you did not order. Very common because there's very high reimbursement rates for those drugs, and we see that just repeatedly. It'll take a dip and come right back up again. I'm gonna have to skip through this just because of time, but I would encourage anyone. There's a series on telemedicine, Fleecing of America on NBC. A great little segment on the nature of what we're dealing with in terms of telemedicine fraud right now. Our initiatives, we're going to continue to focus on the big providers, dealing with, in many cases, medical providers that are engaged in big fraudulent billing schemes. Sometimes hospital chains can be involved in this, or they'll hire billing firms to help them maximize profits that are crossing the line into fraudulent activity on the large scale. And also we're focused on criminal enterprises. Believe it or not, we're seeing criminal enterprises get involved in COVID testing laboratories, just general laboratory testing, and sometimes operating pharmacies, just because they're very lucrative in terms of fraud. Now, these are folks with, by all accounts, no medical background whatsoever in most cases, but they've seen an opportunity to capitalize on the huge expenditures that in this country on medicine and medical services, and they've taken advantage of that. And that's something that we take very seriously and are focused on here in the FBI. Again, we're constantly working with our state and local partners in the area of Medicaid, working very closely with the state attorney general's offices and the Medicaid fraud control units to address fraud at that level. You see that a lot in the area of home health care. And again, in the area of home health, you may see fraud manifest itself as, you're patients getting a visit once per week by a provider, but the provider's billing as if they're visiting that patient 5 times per week, or they're just not showing up at all. The patient's neglected. So that's something we very focus on, and especially the Washington field office very closely in terms of home health fraud. Again, the prescription drug initiative, that's really our part to deal with the providers that are fueling the opioid epidemic in this country. So we're going off after the doctors and medical staff and other medical professionals that are, turning their back on their license and their obligations to just provide, drugs to the public for profit. Our National Nursing Home Elder Fraud fits in with, the Elder Justice Initiative with DOJ, but please keep in mind, nursing homes, big area for fraud. We work closely with the state, both criminally and civilly on that side as well. But what we're looking for is inadequate care in these facilities. It might manifest itself as neglect of the patients, billing for very expensive equipment, and they're not getting the same quality equipment that Medicaid is being billed for, or their insurance is being billed for. But a big area of focus for our partners at HHS OIG and us as well. And we can talk more about that in the question and answer session. Talked about COVID fraud and some of the DOJ initiatives. We have strike forces in certain areas of, high Medicare claims data throughout the country, where we see a lot of claims out of like Florida, where there's a big retirement population, Los Angeles, Houston, a couple areas in Texas. We've set up these Medicare fraud strike forces where we partner with our law enforcement partners and with DOJ to focus solely on healthcare fraud. In 2021, September, we announced a big takedown with DOJ, collective with our partners again, about $1.4 billion in losses. That point, 1.1 billion was attributable to telemedicine alone, just to kind of show you the scope of the threat. These are the strike force locations. And we've also got another unit in some of the U.S. Attorney's Office to deal with the opioid epidemic. We talked about sober homes. Sometimes these are just locations that somebody with no medical background buys and tries to do as much as they possibly can to defraud. And in many cases, it's private insurance involving that reimburses for sober home treatment. But seeing an expanding threat, particularly in Southern Florida and California, to more attractive for folks to go there for treatment. So how can you protect yourself? Protect your health insurance information card like you would a credit card. That includes your Medicare beneficiary information. Very, very valuable to some of these fraudsters that we see. Once they have that number, they can do a whole heck of a lot of damage before law enforcement finds them and stops them. So just be very careful about unsolicited contacts asking you to provide that information. Sometimes they do it by offering free services. So be careful if you get a call and they say, hey, this is free. Just give us your Medicare information. We'll give you this. We'll give you this wheelchair. We'll give you the scooter. Reach out to your provider that you have a relationship with. Find out if that's legitimate or if it's really needed. Because many cases, it's just a way to get your information to perpetuate a fraud elsewhere. I'm guilty of this myself, but please, you might be asking through all of this, how do I stop this? How do I do my part? The single most important thing that you can do is to review your explanation of benefits after you go to the doctor's office or any other medical service that you obtain. Take a look at that EOB. It's not going to always be clear. If there's something that doesn't seem right to you, you can start by calling your insurance company and they can look into it. You can certainly call us at the FBI, 1-800-CALL-FBI or FBI.gov to report it, or even to HHS OIG, the Office of Inspector General. We all communicate quite frequently, but I would encourage you, if you see something specific, please take the time to report it. But you can only do that if you take the time to just take a quick look at your explanation of benefits after you get a service. It would mean a great deal to us, and it certainly helps us out a lot. So that is pretty much all I have. I'm sorry I've run over a little bit here, but thank you, and I'll turn it back over to Amy.
Thank you, Greg. And wow, there's never enough time to dive into all the details, right, that we're looking for. So without further ado, we're going to flip the virtual microphone over to our other expert with us today, Amy Knopfziger, who is the Director of Victim Support at AARP. Amy, could you take a few minutes and explain how AARP is involved in these kinds of frauds that affect older adults?
Yeah, absolutely. And thank you so much for having me here today. So obviously, with 35 million members across the country with AARP, and the majority of them over the age of 50, you know, healthcare fraud is a significant issue to us. All fraud is a significant issue to us. So we have the AARP Fraud Watch Network. This is a free resource for anyone of any age, and you actually do not have to be an AARP member or even over the age of 50 to participate in this. We have fantastic tip sheets, webinars, the Perfect Scam podcast, but most importantly, and what I focus on my daily work, is the Fraud Watch Network helpline. This is a toll-free helpline for anyone of any age to call about their target of victimization, or sadly, if they have been a victim, to get one-on-one assistance with the trained fraud specialist. We get about 500 phone calls a day. And prior to this webinar, I was going through the cases, and probably just yesterday alone of those phone calls, about I would say maybe 50 of them had something to do with healthcare fraud. So it's a big issue and it's a big concern. And it's not just the money that is lost. I mean, we always focus on the money that is lost, and I know that's significantly important, but it's just the loss of security. It's the loss of trust. We've had many victims say to us, you know, it's something that I might think is a simple thing, like, you know, okay, you provided your Medicare number to somebody, we can get that taken care of for you. They've lost sleep for days. This is something that really affects the mental health of people out in society. So we're trying to change that. Additionally, one of the things that we're trying to do is change the language of victimization, right? You don't fall for a scam. You are a victim of a scam. You are a victim of healthcare fraud. Right? When people say, oh, this happened to me, we don't say, well, you should have known better. Why don't you know that, right? We say, I'm so sorry that happened to you. Really changing the language of victimization so more victims will come forward and share their story with law enforcement or whoever they share their story with to recover from it. So I'm happy to be here today to answer questions, and just to let you know, the resources of AARP Fraud Watch Network, we work pretty closely with the FBI and share a lot of data with them, and also the FTC on the cases that we get. So I look forward to your questions.
Thank you, Amy, for that quick overview. And here's the really fun part of today, where I get to bounce lots of your questions off of our two experts with us today. I think you can tell that this is not a problem that only one entity or component or agency can solve. So it's fantastic to have experts from both government and nonprofits. So we're going to start by kicking it back to Amy for the first question. How can I spot potential fraud or abuse that's affecting people I know? Greg had talked about looking at your explanation of benefits. Do you have thoughts, Amy, about other specific ways that folks could flag some of those indicators of fraud?
Yeah, absolutely. And this doesn't just pertain to healthcare fraud, it's really all fraud. Is the request coming in unsolicited, right? So are you getting an unsolicited phone call, email, or text message that is asking for some personal information? And let's be clear, your Medicare number or your health insurance number is personal information. One of the interesting things that happened was when the Social Security numbers came off of the Medicare cards and a random 11-digit number was replaced with them, a lot of people had a false sense of security about providing their Medicare number, because they're like, well, it's not my Social Security number anymore. I can give it to somebody. You can't, because again, as Greg said, we're losing, millions to billions of dollars in healthcare fraud. Additionally, think about what they're asking, especially if they're asking for some form of payment, right? There's about 70 scams that are circulating right now. And I always say, if you don't need to know about all 70, you just need to know about the 5 most preferred ways of payment or what the criminals are asking for. So if they're asking for your Social Security number, stop, scam. Medicare number, stop, scam. If they're asking for payment in a prepaid gift card, and when I say prepaid gift card, I mean one of those colorful things that you see at the grocery store that is branded. Those prepaid gift cards are currently soon to probably be bypassed by Bitcoin, but the #1 preferred method of criminals for payment. So if anybody in your family says anything about a prepaid gift card and it's not for a birthday or a graduation present, stop, it's a scam. So additionally, if you hear crypto, Bitcoin, ATM machine, any of those key words, that is definitely a red flag and to stop. And then finally, one of the ways of payment that we hear all the time is with the peer-to-peer apps. And the peer-to-peer apps, the common names are Cash App, Venmo, and Zelle, Z-E-L-L-E. Those are oftentimes even advertised at your banks. And so people have, again, that sense of security because, well, my bank advertises it, it must be covered by FDIC insurance. It's not. It's an untraceable way for you to send money to family and friends. So anyone who is calling you over the phone saying that there's a problem with any one of your accounts and they want payment that way, it's a scam because they're not your friend. So, I mean, I think just right off the top, those are some quick things, just some trigger words for you to think about and to share with your family and friends.
Greg, I see you nodding your head a lot as Amy is talking about gift cards and Zelle and Venmo. Are you seeing the same sorts of issues from the FBI when it comes to payment methods for scams?
I couldn't agree more. I mean, those are great points. I think, and even urgency. I mean, most medical providers aren't going to tell you that you need to pay instantly, or you need to get in the car and go get, a gift card instantly and send it somewhere. So that is a red flag in and of itself. But yes, any of those, I guess, to the extent you can call them non-traditional still, but any of those non-traditional payment methods aren't generally, normal in what you would expect to have to pay a provider that you have a pre-existing relationship with. So right off the bat, no, I couldn't agree with Amy more on that.
And flowing into a question that came up with a registrant for this webinar, and it came up last month too in this same Elder Justice series, how are the fraudsters getting access to older adults? We're talking a lot about targeting older adults. How are they finding the older adults? Like, how is it that the scam artists are specifically focusing on older adults gaining access to older adults? Greg, can you take that first? And then Amy, I'll ask you to weigh in as well.
Yeah, I mean, and Amy will have probably a broader idea of how it happens generally, but just speaking from the cases that we saw recently, and I alluded a little bit to it in the presentation, but we were seeing people approached as they were walking out of grocery stores or pharmacies to get that information. Now, this was kind of during the height of the pandemic, and it was when people at one point were desperate to get COVID tests that weren't readily accessible, and then it kind of transitioned to people that were desperate to get the vaccines that weren't readily accessible. So we saw not only the unsolicited calls to folks saying, hey, listen, I got a spot in line for a vaccine for you, before anyone could go and get one. Just send us, whether it's a gift card or cash, and we'll get you that spot. Or, sometimes it was give us your Medicare number, and then they just ran with that without even, any other mechanism to get cash. But it was the unsolicited calls. And then it was just just meeting people as they're walking out of stores or running their errands to get that information. So probably not the most, common way, but that's what we were seeing the most of in the last, I'd say, 2 years.
Wow, Amy, how about you? What else seen in AARP?
Yeah, so I mean, we talk a lot about how, because people are like, well, how did they know I was on Medicare? And I'm like, well, if you're over the age of 65 in this country, let me guess, big thing, you're probably on Medicare, right? So your information is big business for not just legitimate companies, but for criminals as well. So, your name is bought and sold every day in listservs, data brokers, it's big business. So be careful that where you put your name and any of your information, anytime you're filling out forms, ask, is this necessary? When you go to a fair, when you go to a mall and you see, you could win a prize or get a free lunch or something. Anytime you write that information down, it might be bought and sold. And, credit bureaus, I mean, they buy and sell magazines, the DMV. I mean, we share all of this information out there. And, criminals do target older adults more often because you hold the majority of the wealth in the United States. However, they will steal from anybody. Right? So this isn't just an older person problem. Criminals will steal from anybody. but they could try to steal from my 17-year-old son who's got 10 bucks to his name right now, maybe, or they could steal from my mother who has built a lifetime of wealth. They don't care, they will steal. But, really where they find you, I think, is a lot of these data buying, data brokers. And so just be very careful about who you share your personal information with. And when I say personal information, that's even your name and your cell phone.
Wow. What happens, or what do you recommend if someone who's attending today thinks that they see signs of fraud? What is the first thing that you think they should do? Amy, I'm going back to you first, and then Greg, give you a chance to weigh on that. Amy.
So it depends. I mean, one, report it, and two, stop. I mean, and those can be simultaneous. Like, right, if you're in the midst of something that you think is a fraud or a scam, I mean, stop. Hang up the phone, all of that kind of stuff. Don't give your personal information out, and then report it. Reporting is key. You can report it certainly to the FBI. You can report it to your, state's attorney general's office, local law enforcement, AARP, Fraud Watch Network helpline, and we can get you to the right spot. But I always say it's really important to report it because there might be additional steps that you need to take to then further protect yourself. Perhaps if you did provide your social security number along with your Medicare number, you're going to want to put a fraud alert on your credit report. So those are often my first two steps, is to stop it, report it, and then finally share it. Share it with a family member, a trusted person, so you don't walk this journey alone.
Great advice. Greg, anything you want to add to that?
No, that's good. I agree with all of that. And I think a good point came up, Amy, about not being embarrassed. I mean, I will tell you that so many people feel so embarrassed that this happened to them, but everyone needs to understand that these fraudsters that are engaging in this type of behavior are very, very, very skilled at what they do. They've mastered the ability to do what they're doing. And they dupe some of the most intelligent people that I've come to know and see in these cases. So just don't be embarrassed about it. If it happens, like Amy said, you just get, stop it and then report it, and take the time to report it, because think about, it's not just you that was victimized. There's probably a whole slew of other people that experience the same thing, and they may not have taken the step to report. It doesn't hurt to get the call. We can certainly look into it further and say, oh yeah, we in many cases we might already have an investigation on the person, and that just further solidifies that we're going down the right track. But yeah, everything that Amy said as far as stopping and reporting is key. And even your insurance companies. I mean, if you don't feel comfortable reaching out to law enforcement, certainly reaching out to AARP to report it, or as a first step, or to the insurance company to say, hey, this doesn't quite look right. They can do some internal work to reach back out to the provider and say, hey, we're seeing it's all done by billing codes. They can reach out to the provider and say, hey, it looks like this code's coming up quite a bit. They might be able to resolve it there, or do their own action to stop it, and then they in many cases will notify us if it turns out to be a much bigger issue. So bringing awareness to it is so important in that first instance.
Greg, you bring up a really great point too about the fact that these criminals are professionals at what they do and really, really good at committing crimes. One of the folks who was attending today submitted a question in advance about how do the fraudsters actually convince the older adults to tell them stuff? What are the techniques they're using to cajole people into revealing that personal information that's better kept safeguarded? Do you have thoughts about that? Greg first, and then Amy, I'll flip to you.
I think Amy touched on it earlier too. I mean, sometimes it's as simple as, like, for instance, genetic testing. Genetic tests for a provider or for a laboratory are very lucrative. If you conduct a genetic test, you get quite a bit of money reimbursed from the provider, whether it's Medicare or private insurance. If somebody, usually a marketer in this case, who's in some sort of a kickback relationship with a lab, will approach somebody and they'll say, hey, do you know that there's a lot of benefit that can come from getting a genetic test? It would potentially keep you from engaging in some sort of behavior that might make you more susceptible to cancer. It might indicate whether or not you have, obviously, the genetics to be susceptible to cancer. So it would prompt you to go get some additional tests. And in many cases, there doesn't seem to be anything really nefarious about that sort of a situation. However, when it's unsolicited like that and not coming from a provider that you have a pre-existing relationship with, what we've seen is it's either to get your Medicare or provider beneficiary information to engage in some other fraud that's completely unrelated to you, and you're doing it for the best intention to maintain your health. So it's pretty much an easy, oh geez, I can help stay healthy longer in the future and live longer, and sure, I'll give it to them. But that's how the fraudsters do it, is they give you some inducement to provide that information. It's whether it's helping yourself or helping a family member. So I think the key there is just really the fact that it's when we see it, it's generally unsolicited, and that's a red flag right off the bat.
Amy,
Yeah,
go ahead, Amy. Go ahead.
I was gonna say, I can add to that. I mean, we talk a lot about, because with the victims that we speak to, every day, they'll even say, I have no idea how this happened to me, right? I have a PhD, I have blah, blah, blah. We talk about how you're not in your cognitive thinking brain when you're faced with one of these scams. You're thinking emotionally. So let's take the genetic testing. You get an unsolicited phone call during the day, you're busy, you're making lunch, the doorbell's ringing, the electrician's coming over, and they say, Mrs. Smith, your doctor called us to let you know that you're susceptible to cancer and you have cancer in your family. That's correct, right? All of a sudden, it's like, Mrs. Smith is like, oh my gosh, what, my doctor's calling, he knows my history, I have cancer in my family. Yeah. Well, he wanted this genetic testing. We just need to confirm your Medicare number, and they talk fast and they get you into this emotional heightened state. So again, you're thinking with your emotions, you're thinking, well, I have to find out if I have a genetic predisposition to cancer because I do have cancer in my family. Who doesn't have cancer in their family, by the way? They said my doctor recommended, they had my doctor's name. Oh my gosh, I have to act on this quickly. So going back to what Greg said with the urgency, yes, hold on, let me get my Medicare number for you, provide it. I took care of something today, now I can go focus on the electrician. And then all of a sudden, it's like later that day when the emotions come down and we're sitting down to dinner and we're drinking our tea, we're like, wait a second, what did I do? Because we're back in our cognitive thinking. So the victims of these crimes are very educated, they're very smart, they're very savvy. The criminals know what emotional buttons to push to get them under their ether so they can steal from them.
Wow, I think we really have hit on some excellent nuggets here today. And in just a moment, I'm going to ask each of you to share what you think would be one great final takeaway for the audience to take home with them after the webinar wraps up. What I hear you all both talking about is appealing to emotions, unusual forms of payment, the sense of urgency, and unsolicited asks or unsolicited gifts. Those seem to be common threads among all that you've talked about, whether it's COVID-related fraud or telemedicine or any other more traditional fraud. Can you encapsulate what you think the big takeaway should be? Greg, I'm going to first toss that microphone over to you, and then Amy, for what would you like the audience to take away?
Sure, thanks. I mean, I think the biggest thing for us as an agency and what would help us to, maintain the system that we have and all benefit from is just really the explanation of benefits piece, because that takes us into the realm of, unscrupulous providers. And just, if we have the public on our side, taking the time to just take even a quick look at those EOBs to see if it's consistent with what you recall the visit to be and the services that you received, that means a whole heck of a lot. Because if that doesn't happen in that instance where the patient's reviewing it, then we're waiting for data over a number of years to reveal some sort of abnormal billing situation. And then we're going back much further. And by that point, a lot is lost. So the one takeaway I would say, and I'm guilty of not doing it myself, quite honestly, is just taking a quick look at that EOB. But that's it for me. Thanks, Amy.
Thanks for that, Greg. All right, Amy, what's your recommendations?
Yeah, first I want to share the Fraud Watch Network helpline phone number. So it's 877-908-3360. I wanted to share that, and again, it's a free resource for anyone of any age. So my big takeaway today, and this is all frauds, not just healthcare fraud, is think about right now, the last time you felt stress, emotional stress in your life. We all have it. We all know what it is. So then take that moment, and if you ever feel that when you're on the phone with someone who has called you, it's most likely a scam, because again, think about the emotions that these criminals are trying to get you to feel, because again, they want you to think emotionally. I had a woman just recently who was on a 3-day scam journey, and she has significant back pain. And she said, you know, for the first time in about 20 years during those 3 days, I didn't have back pain. And I said, because your body was filled with adrenaline and emotion that it was masking the pain. So if you're feeling that and you're on the phone or a text message or an email with anybody asking for information, stop, get away from the situation and call and ask for help.
Great tips from both of you. And I wish we had more time to talk about all these things. Unfortunately, we're coming close to the end of our time. I do want to remind everyone you dialed in today, the series does continue every Wednesday for the rest of the month. And if you submitted a question, either when you registered or during the webinar, and we didn't get to your question, have no fear, because the 4th session in the series is only to answer all of those questions that haven't been addressed yet. So the answers are coming, but not until the 4th session, unless we get to it before then. Remember that you will get a certificate via email tomorrow that confirms your attendance today. You can use that for continuing education credits if you like. You will also see when you exit the webinar today and again tomorrow, a link to a survey. We read every response that you give us. Every comment is important to us, and we'll share feedback with the speakers about how you think they did today. So that is your chance to submit your thoughts. I won't give them your name, just your thoughts. So it's all anonymous, so totally safe. We talked about the certificate and the survey. Great. So next week we'll meet up again, same time. So Wednesday noon Eastern for those who are on East Coast time. And next week is going to really focus on abuse cases. So next week our speakers include an FBI agent who works healthcare out of our St. Louis field office, a former federal prosecutor who prosecuted these issues both federally and at the local level, and the deputy director for the National Center for Elder Abuse, who's going to talk about things that they have seen all across the country, ways that we can help keep you safe. Thank you for being with us today. We look forward to seeing you online with us again. Please stay safe out there. Take good care. I hope to see you next week as our series continues. Thanks.